Off you go.
Soft tissue damages. Soft tissue injuries are injuries to muscles, tendons, ligaments, internal organs and skins. A sprain is a damage to ligaments or stretch, a damage to ligaments, a stretch or tear. The cause of a sprain is a joint moving outside its range of movement. Sprains normally happen to the ankle or parts of the body that are exposed and at risk when during playing sport. For example, playing a football match and quickly changing direction, but not changing the position of your ankle quick enough. You may sprain your ankle because it will be outside its range of movement. A strain. A strain is damage to the muscle or tendon, usually in your foot or leg. The strain may be a simple stretch in your muscle or tendon, or it may be a partial or complete tear in the muscle and tendon combination. The recommended treatment for a strain is usually the same for a sprain: rest, ice, compression, and elevation. This should be followed by a simple exercise to relieve pain and restore mobility. Concussion. A concussion is normally caused by a blow to the head, which causes the brain to shake inside the skull. You don't have to pass out to have a concussion. Sometimes you may not even know that you have a concussion. Usually,
That's all right, just carry on. Go to the next slide.
this is the exact, oh, that's what it was. That's all I needed there, that topic. Hard tissue damages. Hard tissue injuries are injuries to the bones, joints and cartilage. A fracture is a complete break in a bone, which is the most common form of a hard tissue injury. Most fractures are due to direct impact on the bone. For example, Aaron Ramsey's injury in 2010 was a fracture at his ankle because Sunderland defender Shawcross made a very dangerous challenge and caught Aaron's ankle, which made his ankle immediately lose complete function. There was direct impact on his ankle bone when Shawcross slide tackled with speed and power. This was the very moment that caused the injury. Stress fractures. Stress fractures are common to marathon runners as they are constantly running. Stress fractures are caused by repetitive stress on bones in high-impact sports. They usually pain quite a lot, but usually heal by themselves with the right amount of rest. However, if these injuries are not rested and still being worked on, they can then turn into proper fractures, which will pain a lot more and will require treatment to recover. And this will take a lot of time than it would take for a normal stress fracture to recover. For example, Manchester United defender Vidic had a stress fracture on his ankle, but instead of resting it for the appropriate amount of time, he then decided to play a Champions League match and completely fractured his ankle, which made him lose complete function of it, which caused him not to participate in any sport from 8 to 9 months. First aid immediate treatment. Priorities. When treating a casualty, it is important to prioritize the most important injury and treat it first. All you need to survive is a constant supply of oxygen. Therefore, the main priority will be to get oxygen into the bloodstream, making sure that the blood carries on circulating, and then stopping any active bleeding so that blood isn't lost. Resuscitation. It is very important to check that the casualty is breathing. You do this by holding the side of your face close to their face while looking down at their chest, so you can feel or see them breathing, like up their chest. If the casualty isn't breathing, you're to perform a form of resuscitation to them. So this could be mouth to mouth or using your shock. Shock is a life-threatening condition that occurs when vital organs such as the brain and heart are deprived of oxygen due to a problem affecting the circulatory system. You should look for fast breathing, pale faces, and cold skin. To treat shock, you should raise like a person's leg while they're laid flat on the floor to keep the blood flowing, bleeding. You should stop heavy bleeding by using whatever is available to apply pressure onto the wound to prevent heavy bleeding and loss of blood, because losing blood can lead to serious complications. So like if you have like a towel or something, you can apply on it. Unconscious casualty. It is important to check that somebody is conscious before treating them. You can do this by speaking to them to get a response or gently applying pressure to their body and receiving a response. If a person doesn't respond to any of these two, it is likely that they are unconscious. Fractures. If you're treating somebody with a fracture, it is very important that you make sure that you do not move them unless it's necessary to prevent further injury. You should apply ice to the wounded area. Make sure you don't try to realign the bone or push the bone that's sticking out back into its place, because that can make the matter worse. Prevention of infection. To prevent infection to a wound, you should clean it thoroughly and cover it with a plaster. Someone qualified assistance. Make sure you call 999 for professional help. But until they arrive, you should make sure that you keep checking to see that the casualty is breathing and try your best to stop any bleeding until professional help comes. Accident report forms to keep history of the casualty in case of future references. Common treatments. There's a price for protect, rest, ice, compression and elevation. Protection. This is protecting the affected area from further injury. For example, somebody who has broken their leg might have a cast over their injured leg to protect it from being touched with enough force to give it further injury. Rest. This is another form of common treatment as resting, avoiding exercise and reducing your daily physical activity level, because this will aggravate the injury and may cause re-injury. You should also try to keep as much weight off the injury as possible. So some people use crutches to keep weight off of their ankle if it's broken or leg and that. Ice. Putting an ice pack on the wound for around 20 to 30 minutes will reduce swelling. You can use a bag of frozen peas or anything similar, but you should wrap something around it like a towel to avoid direct contact with your skin, because you can get ice burn. Compression. You should use elastic bandages to stop swelling. And elevation. You should keep the injured leg, knee, arm, elbow raised above the level of the heart. Soul taps. You should stop and observe the injury before treating it. You should ask questions about the injury. Look for specific signs and indicators of injury. Palpate the area gently to identify painful areas and swelling. Active movement. Athletes move. Make sure the athlete moves the injured part by themselves. Passive movement. You move the injured part for the athlete. And strength testing. Ask yourself if pressure can be placed on the injury to see how strong the injured part is.